I'm Dr.Diluk Senadheera, one of the consultant obstetricians and gynecologists. Contraception. When to discontinue contraception when you are planning for a pregnancy? Well, it depends on the method. If you are using a non-hormonal contraceptive method such as a loop inside your womb, the moment that we take it out, you can get pregnant. But however, if you've been on a hormonal method, at least 3 months before you should discontinue. The reason is there might be a delay for you to start your ovulation cycle again. Then we're going to talk about the medical conditions. There are two aspects for this. One thing is period abnormalities. If you are a person who's having severe pain while having periods, you could be suffering from endometriosis. If you are suffering from heavy menstrual bleeding, maybe you are having fibroids, maybe an endometrial polyp. Or if you are a person who's not getting regular periods, skipping of periods few months, so you may be having hormonal disturbances, which is commonly called polycystic ovary syndrome. So if you have any of that, it's always best to present to your doctor before and get an ultrasound scan done so we can identify things earlier and plan things early. Second entity is medical disorders. So it could be diabetes, it could be high blood pressure, it could be epilepsy, it could be asthma, it could be cholesterol. There are so many things. If you are on medication for any of these conditions, it's quite important to take the dose adjustments. Some of these medications, as an example, statins that we take for cholesterol cannot be taken in pregnancy. And some of the drugs that we prescribe for epilepsy, antidepressants, maybe drugs for diabetes, some of the drugs for high blood pressure cannot be taken in pregnancy. So they have to be adjusted or replaced with certain different medications. Another important aspect here is when you're going into a pregnancy, if you're suffering from any of these diseases, it has to be properly controlled. As an example, if you're suffering from diabetes, if you have diabetes, it needs to be properly controlled. There are tests that will give you an idea about the long-term control of the disease. Another thing that your doctor would want to know is whether your organ systems are functioning properly. If you have these medical conditions, he might suggest for you to take your kidney function tests, liver function tests, or maybe checking your heart with a simple ECG or an echocardiogram. All these things might come really handy before planning a pregnancy. Another common problems related to the thyroid gland and the thyroid hormone. Even though we don't always test your thyroxine levels or the TSH test, if you are a lady who's suffering with any of these symptoms, or if you have thyroid enlargements, your doctor will always suggest a TSH test and at least a TSH test before getting pregnant. Likewise, if your hemoglobins are low, he might suggest you a full blood count. It's always best to replenish before planning a pregnancy. We cannot talk about pre-pregnancy preparation without talking about your immunization status. Be it rubella, be it mumps, there are so many other diseases as well. So you need to have an idea about your vaccination status. If you have a doubt or if you're not sure whether you have had this vaccine, please do get yourself tested. We can do a simple antibody test for this purpose. If you don't have immunity for these diseases, you can simply get the vaccine and delay the pregnancy for about 1 to 3 months depending on the clinical situation.